Hello, welcome to Skin Cancer Specialist. Today we'll be reviewing post-operative instructions. After your procedure, you will have a prescription for an oral antibiotic, a topical antibiotic ointment, and an oral pain medication sent to your pharmacy electronically. Please remember to pick these up and take them as directed. Over wound care instructions for after the bandage can be removed. After removing the bandage from the surgery site, you can gently wash and dry the area like normal. You will need 1 tablespoon of white vinegar in a cup with warm water, or half a cup of hydrogen peroxide undiluted. Gently clean the area with hydrogen peroxide or white vinegar. Do not pour vinegar or hydrogen peroxide on the surgery site. Apply a generous amount of antibiotic ointment and keep it covered with nonstick bandage. Perform site care twice per day until it has healed. Usually takes 2 weeks or until your suture removal appointment. Call our office or text the Klara number if you're experiencing any of the following: constant fever above 101, intense pain near the surgical site, increased swelling, redness, or uncontrolled bleeding, reopening of the wound at any time, yellowish drainage from the wound. You may also send pictures with your name and date of birth to 832-789-3653 via our secure text messaging system, Klara. Choosing Dr. Klara with Skin Cancer Specialist.